And I think, Sean, you're gonna summarize the other.
Because it's not gonna be, we have to do my part.
The
I mean, I think us too, I think too much short.
Oh, you gotta call Robbie. Okay. Everything gotta be plugged in again. Never mind. I'll just get this and then. Yeah, just. Oh my goodness.
You got it? Okay.
Yeah. What you just.
I didn't realize that to work. It's not like I'm not getting it free.
So why not? Yeah.
Yeah.
I'm worried about.
Yeah.
Oh, so how did it?
No, that's good.
That's better. Really?
I watch it, and I watch it, and I'm like, so that.
No, I thought I read it. I mean, I know it will be me about the stuff we get passionate about. I mean, because it is sort of. Yeah. Wow.
Aloha mai kako. This is just an update that the House is still in session because they had a long agenda. We would love to have them join us today. So thank you for your patience. We're expecting the start time to be at about 1:30 p.m. Mahalo.
Yeah. Yeah, but I think that's why.
So two things, we have, car, so we talked about
Sorry, I sent a love letter. Yeah. Maybe I'm sure that. Oh, good. Good. So, thanks. Sorry.
Hello, everyone. Sorry that we're starting a little late, but the House is still in session. They were, the last we heard, they're on the last bill. So hopefully we will be starting soon. So in about 5 minutes, but if you can all move up, I think it'll be warmer if you move up. So we are recording this so that if you missed it or you have friends that have missed it in your network, it will be recorded. So move up, everybody. It's actually more comfortable in the front.
Yes, no. I'm just trying to.
Aloha. Good afternoon, friends and advocates. We are here gathered at the State Capitol Auditorium to focus and tackle one of the most pressing issues here in our state, long-term care. My name is Banette Misulucha. I'm the Executive Director of the Workforce Development Council, which is the policy and planning advisor to the governor on workforce issues. It's my honor to serve as your MC today. So may I request those of you who are in the back to kind of come up here. This is not church, you know, we're not collecting. Come on. Thank you. So this is actually day 2 of a summit that started yesterday. It was the most wonderful and amazing event. We had about 65 stakeholders gathered. Their minds were ready to learn, hearts willing to collaborate, and spirits filled with aloha. So you'll hear more about what happened yesterday from some of the speakers who will be sharing their insights today. So what are we trying to accomplish? Today, we're closing the loop on the first step towards creating a long-term care system that will work for Hawaii and the unique needs that we have. So you'll hear from experts and the amazing examples that other states are modeling. So at the end of the day, you will witness a visual demonstration right here of the commitments from organizations and agencies who are willing to roll up their sleeves and become champions for this cause. So to our friends at our legislature, I want to just single them out right now. I want to make sure that we acknowledge them properly. We have, and I know Senator Carol Fukunaga was in the House earlier. So can we just still give her a round of applause? Senator Joyce San Bonaventura. Senator Troy Hashimoto. Representative Della Albilati. And of course, Senator Sharon Moriwaki. And hopefully the rest of them will be joining us at some point this afternoon. And of course, we're going to properly acknowledge our Lieutenant Governor very shortly. So let's get started with some opening remarks. First, we would like to bring up on stage this feisty leader who kind of corralled everybody. I don't think she took any notes for an answer, so that's why we're all here. Ladies and gentlemen, please welcome the Senator from District 12, Senator Sharon Moriwaki. Thank you, Vanette. Some of you who've been with us yesterday will know that we try to keep a tight schedule, but they have to apologize that the legislature doesn't work that way. We have session, we have different committee meetings going on. So the House is still meeting and we hope to have them here shortly, but they're still in session. So we decided not to take any more of your time and to start because everything is being recorded. So we can share this information, which I think is very important as we go forward to really address an area that has been neglected for way too long, our long-term care for our kupuna. This is a problem that I know my colleagues and I really have wanted to grapple, but because of the cost, because of other priorities, it hasn't been front and center as it should be. So I'm really glad that we have this opportunity with the help of the Council of State Governments and also the American Healthcare Association that we've been able to bring some experts to us to see what other jurisdictions are doing and the trailblazers in terms of looking at what we want to do. We have all the services and we have a lot of committed people. But the getting together, the coordination, the how do we pay for this rather than stepping away from it, getting and looking at what is the way forward that we can have a sustainable, affordable care system that will look at the individual, the person, the kupuna. And I want to say that over 60 years ago, this body, the legislature, actually did declare and put into law that we take care and honor our kupuna. And I want to just read to you just part of this long chapter 349 that you can read for yourself. But what they said was, it shall be the policy of the state and the counties to provide comprehensive programs which will assure the coordinated delivery of a full range of essential services to our older residents, with full and special consideration to older residents with special needs. That's everything. And that is a coordinated system of care, and that is person-centered, so that we forget, because we're all doing services and everything is so much problem in terms of getting the funding and getting the all of the programs to serve the ever escalating numbers of elderly, as well as escalating and ever escalating cost of care, that we really need to rethink how we do this business of taking care of our kupuna. And that's why we're here today. That's why we've been working on this for a couple of months. And that's why we're asking my colleagues to support us in looking at some of these really knotty issues that we've been sort of skirting all these years. And you will hear from Nisha Hamill from the American Healthcare Association. And I was really surprised that we put a lot of money as a country into long-term care. But she has this graph that is kind of scary. That we put the most money of all the countries, and we have the worst outcome of all the countries. Now, if you look at that, you've got to see that we've got to do something differently. We can't be putting more and more money into something that doesn't work. And that's why we're here. We're hoping that over the year to come, the support of my colleagues, that we could really start looking at developing a real plan, a plan that coordinates what we do from home care, and I take home care includes supporting caregivers and volunteers who actually help make life much more enjoyable for being at home and getting services than being an institution that is the highest. This is why we're here. This is why we're going to continue to work on this. And we've got experts, we've got people who really care that's been doing this work for the last 17 months of trying to plan this session and the session yesterday. But I want to just say that I'm really pleased that all of you are here. I hope my colleagues will be coming soon. If not, this is recorded, but I do want to say that the over 60 people and organizations that met yesterday that Bennett talked about, they were really committed to this new system of, not new because we had it in a plan in 1988. But we've never dusted it off. I mean, I think I have one, thanks to Caroline, one of 6 copies that exist in the state. So, but what it is a person-centered care system where you've got all the services, but you also have policies and programs and people working together so that those services go to the person and the person can choose, because we can make that affordable because it's going to be part of the whole system of care. And that's the challenge. And that's what we put out there that we hope we can do in the coming months, the years ahead, to fund the things that are most important to make our kupuna live their older years all the way until they leave us to a better place, as comfortable, enjoyable, and dignified as possible. So I hope that you hear all the experts and all of the local and national experts that are here today, and really think about this, because this is, I think, so important for us as a state, for us as a community, for us as people. So mahalo for coming, and I yield to Bennett again, our taskmaster. Oh, there she is. Okay, all right. So thank you, mahalo and aloha, everybody.
Thank you, Senator, for your leadership. Someday when you look up Wikipedia and it says advocate, there's a picture of Sharon Moriwaki there. All right. Well, you know, I'm remiss because we kind of changed things around. We need a blessing, whether it's the beginning of the program or the middle part. So may I ask Kili'ili to please come up and give us a pule. Kili was there yesterday, by the way. He's one of our advocates and champions.
Aloha kako. My name is Kia'i. I'm the traditional Hawaiian Healing Services coordinator at Papa'ololokai. And thank you, Poki Balaz, for asking me to do today's pule. Before I do the pule, I would like for all of us to go into a moment of silence first. In Hawaiian, we call this kukulu kumuhana, which is like a collective consciousness, single thought, and in mind, body, and spirit for the reason why we're here, which is Hawaii's kupuna. You know, and so I would like you to close your eyes and think about who are the kupuna in your life that you'd like to bring with you today. It could be a grandparent, a parent, a teacher, a mentor, a coach, a friend, a patient, a loved one. To the powers that be, to the powers that we believe in, from the rising sun in the east, in Kaikinaokala, to where it sets in the west at Komohana, from Akau in the north to Hema in the south. All that is above as well as below. We're grateful for this opportunity to gather today in Hawaii's capital. to discuss the future of long-term care for all of Kupuna in Hawaii. We're grateful for the organizers of this event, their staff, the volunteers, and the generous contributions of supporters. We're also grateful for our elected leaders and public servants. We celebrate and honor their commitment and accomplishments throughout this very important 2024 legislative session. Continue to bless them with discernment and courage in all that they do with the best interests in mind for all of Hawaii. We're also grateful for all those who are with us today to honor and care for our kupuna, our government officials, our staff, various health departments, learning institutions, health organizations and practitioners, nonprofit organizations, families, and caregivers. Bless all our speakers, our breakout sessions, so that we may all have open hearts, minds, and aloha, and the energy and strength to put to discussion all the things that are necessary to bring to life impactful and sustainable policies, programs, services, and humanistic relationships. Also ask for forgiveness of any shortcomings, offenses in our thoughts, in our words, and our actions. Please cleanse us from the top of our heads to the soles of our feet, the four corners of our bodies. Release us of all negativity, any feelings of doubt, guilt, shame, and anxiety. Continue to bless us with life and prosperity and good health. All these things we pray. Amama uno lele vale. Amen. Mahalo.
Amen. Thank you so much. Beautiful thoughts, beautiful prayer. On your program, it says we will be listening to Puki'i Balas, but if you don't mind, we're going to push that part a little bit later when the rest of our legislators will be here, because I think it's a message that is powerful and profound. So, but at this time, I'd like to bring up someone who I'm a fan of. I kind of talk about it. She spent 25 years in public service. Most recently was a state representative and was the House Finance Chair for about 10 years. She's a strong advocate for kupunas as well as for keikis. Ladies and gentlemen, please welcome our Lieutenant Governor, Sylvia Luke.
Hey, this podium, I don't know who put this here, but I can't see anybody. In fact, usually I can't see people in the top, the first two, but I can't see anybody like beyond the middle. So I'm gonna go on the side, but I don't know if I go on the side, I'm gonna be out of the picture. So I'll go here.
Yeah, there you go.
Should I move this camera? Okay. Oh, camera is here. Oh, okay. I just wanted to thank the Kupuna Caucus for organizing this. I'm gonna digress a little bit. I'm not going to completely talk about Kupuna, but what I'm gonna talk about is one of the programs that we initiated. So after taking office last year, what we did was we started what's known as the Ready Keiki Initiative. And the reason why I'm gonna tell you about the Ready Keiki Initiative, I will tell you a little bit later. But the Ready Keiki Initiative is a commitment by the state of Hawaii to ensure that all 3- and 4-year-olds have access to preschool. Just like what Sharon said, and 60 years ago, the state of Hawaii committed to taking care of our kupuna. Similar thing happened to taking care of our keiki. In 1989, the state of Hawaii passed a law saying that all children will have access to preschool by year 2000. And year 2000 came and went 24 years ago. So one of the things that I committed myself doing is to ensure that we live up to some of the promises that are made by the state of Hawaii. The state of Hawaii is terrific at making goals and making plans. You have energy goals, you have things for housing, you have things for homeless, you have all kinds of goals. In fact, we talked about this 1988 plan, and we talked about all these goals, and the state of Hawaii is terrific at making goals. The state of Hawaii is not so terrific when we are trying to execute and implement some of these goals. And when we want to take care of our population of people that we take care of on a daily basis, it's important that it's not so much words that we pass, because otherwise it just becomes words on paper. We have to commit to making sure those things are realized. So one of the things I said in the Ready Keiki program is we have to ensure, if we had passed a law in 1988, that we're gonna ensure that all 3 and 4-year-olds have access to preschool. The Ready Keiki initiative, we are going to make that happen. And thanks to the legislature and thanks to the generosity of many of the people sitting here, they committed $200 million which is the single largest state commitment to building public pre-K. If preschool was easy to build out, we would have done that 40 years ago. Just like here for our kupuna. If it was easy to do, we would have done that 60 years ago. A lot of the problems and issues that we have in the state are difficult. And that's why a lot of times we tinker with certain sections, but we don't go to the root of the problem. We don't have, as Sharon mentioned, a comprehensive approach and collaborative approach to doing some of these issues. So let me go back to the Ready Keiki initiative. One of the things I said is, whenever you deal with any state projects, any state programs, it's a given. Things take twice as long, if we're lucky. Things cost twice as much, if we're lucky. Usually it ends up being 5 times as much at an average. And it ends up taking 5 years beyond the deadline, plus or minus 60, if we're lucky. So one of the things that I decided to do, I challenged the departments and people we work with to determine that those 2 things can be overcome. And by the end of, after launching the Ready Keiki initiative in January, we were successful enough to open 11 classrooms in 8 months. They are fully staffed, fully operational. Over 200 kids are getting the services of free preschool around the state. That was done. No need to clap because I know it was terrific and I don't need affirmation. But the interesting part of that also is that we were not just able to open, so fulfill the commitment, but we were able to, the initial cost of each of the preschool classroom was $1 million. At the end of the day, it came out at $410,000 per classroom. It would have been less if one classroom was a little bit out of budget. $410,000. And the reason why I tell you that, the fact that it was substantially under budget, substantially ahead of time, is for every department, every legislator, everyone who works on different issues, it is possible. Do not buy into the same mantra that when we set a goal, when we try to do things together, it never happens, or it happens 10 years later, if at all, or it's gonna end up costing a lot of money. One of the things, I always talk about these things, even if it's at an engineering banquet, and I'm supposed to talk about engineering, I talk about this. Anywhere else, I talk about this, because I want people to believe that it is possible if we collaborate, if we put our resources and do research and push as much as we can. It is possible to get it done in a cost-effective way, in an expeditious way, if we work together. Now, Let's talk about our kupuna. The saddest reality about kupuna services is that when we deal with fundraising for our keiki, fundraising for our troubled youth, there are significant number of folks who come to our aid. There are so many organizations who will do that. Not so much when we're dealing with our elderly services. And when I look out, it's you folks. It's you folks, whether in the health industry, departments, various ADRC program, all the referral service, you folks carry on the burden to take care of our most vulnerable population who have pledged and who have paid the way for many of us. We wouldn't be here if it wasn't for many of the work of our kupuna, and it is our obligation to make sure that in their golden years, in the last few years, that they hold value, that we don't take away their dignity, that we don't let them be homeless, or we don't just look at some of these things as just the cost drivers. These are individuals, these are people. We owe them our responsibility to take care of them. And it's a shame that when we're talking about the keiki, the state plan was about 40 years. 40 years ago, we said we're gonna ensure that all 3 or 4-year-old folk have access to preschool. Now I'm in a position where I can make that difference. It's been 60 years where the state committed to taking care of our elderly. And especially in this Aloha state, it is not just something we have to do. It is our obligation to make sure that it gets done. If we look at all the things that we're spending money on, there is a way that we can pull our resources together, maximize, think of best practices. But the best group of people to get it done is right here at the legislature, because a lot of the departments have their ideas and have their duties, but it's the legislature that has to set policies and pave the way for us to be able to take care of our people. So I just wanted to thank Sharon, thank the Kupuna Caucus for pledging once again to take care of our kupuna. Mahalo. Thank you.
I think I need the roster to or something to step up here. Because it's true, it's hard to see. I can't see who's the first 3 rows right there. Well, thank you so much, LG, and more power. Thank you for your leadership. So our next speaker is someone who I know personally has a heart of gold and generosity, and she's so suited for her role as the Chair of Human Services and Health. Ladies and gentlemen, please welcome Senator Joyce and Buenaventura. She's tall enough, I think.
Yeah, I think so. So although I used to be 3 inches taller, but aloha. I really hate following the LG after that inspiring speech. So what I want to share with you are my personal experiences. I am a member of the baby boomer crowd, which means our parents are the ones we need to take care of, right? So my mom, I want to share with you both sides. And you folks probably have experiences on both sides. Otherwise, you folks wouldn't be here. I mean, both sides in the sense that my mom, thankfully, until the day she died, had the physical capacity and mental capacity to take care of herself. So that was wonderful. And, you know, we were there as support. But the other side are my in-laws who we're taking care of now. They're the ones who had dementia. Some of my father-in-law had such severe dementia that we had difficulty finding caregivers who are willing to even just stay in the same room with him. My husband pledged to them early on that he wasn't going to put them in a nursing home, but he basically took off a year of work. And thankfully, we had the resources to do that. But, you know, it's difficult, right? It's difficult to see your parents deteriorate, your parents who you idolized, who took care of you, just deteriorate. And the reason I'm bringing this up is, you know, as chair of human services, we had money set aside for kupuna caregiving, but those were for the people who couldn't afford caregiving. I'm pointing out the people like me who are middle class, the majority of us, who cannot access the kupuna caregiving program because we have more than enough assets. And thankfully, we do have those assets. But it's super difficult when you have to take time off from work and you can't rely upon those care and your savings start diminishing. So I'm really thankful that Kupuna Caucus put this thing together. Hopefully we could find solutions because it's not only the monies. During COVID, we couldn't find caregivers. We couldn't find the people who are willing to be vaccinated, who are willing. I mean, I come from the Big Island. Those who know what happened at the Yukio Okutsu care home know how needed it was to have vaccinated caregivers. And when you couldn't find caregivers, no matter how much money you had, and we didn't have that much money, but when you couldn't even find caregivers for them to even name the price, that was super difficult. Okay, I mean, my husband ended up having COVID a couple of times. Thankfully, he wasn't able to, he didn't pass it on to his parents. But I am thankful that you folks are looking towards a plan. I am thankful that we are hopefully creating a workforce because that is necessary, as me having difficulty and others like me having difficulty finding caregivers to accept these workforces. I mean, who are willing to work with dementia patients, difficult patients. And I'm also thankful for those providing the type of caregiving and program services for those who are like my mom, who are physically and mentally capable, so that their minds could remain active and so that they could continue to be contributing members of society. So thank you, Senator Moriwaki. Thank you, Representative Corey Chun, who I see finally showed up. Thank you to the Kupuna Caucus for having this, because hopefully we can, like the Lieutenant Governor said, focus on the goal. We are all getting older. We're going to be in the status of needing care ourselves. We need help now. And hopefully with these services and with these programs, we could continue to help our Kupuna thrive. Hello.
Thank you, Senator Sangren Ventura. May I just acknowledge the conveners of this summit. First of all, we have Senator Sharon Moriwaki, Representative Corey Chun, and Caroline Kadirao from the Executive Office of Aging. We also have in the House Representative Lisa Martin. We have, yeah, you can give her a round of applause. Representative Rose Martinez and Representative Shanata Kenuchi. I hope I didn't miss anyone. So at this juncture, I'd like to call up on stage the representative who represents House District 26, which covers Makiki and Punch Bowl. She is the chair of the House Committee on Health and Homelessness, a member of the Human Services Committee. Please welcome Representative Della Al-Balati.
So I'll come around here so you can see me. I'm one of those.
First of all, how many of you realized that you were on YouTube yesterday as you were convening and having your fabulous meetings? Can I hear a show of hands? Well, for those of you who didn't know, it was really amazing to see you at work. It was amazing to see the breadth of knowledge in the room. It was amazing to see the speakers that you had online, the people who joined us from the continent. Thank you so much for being here. The expertise in the room was just incredible. I couldn't be there. I really wanted to be there, but I was just, going from hearing to hearing, looking at bills and doing all the things that legislators do. But I was so inspired by the work that you're doing. And I was inspired by the fact that there is so much commitment. I think one of our mainland guests, just was amazed about the engagement in this place. And it made me kind of reflect back on when I first came into the legislature. I was asked what committee I wanted to be on. I wanted to be on a committee I knew nothing about. And it happened to be Health and Human Services. So I feel like I've been here. I want to riff off a little bit about what Lieutenant Governor said. When I came in 2006, there was a little bit of activity on long-term care, but we had that bill, the 2002 bill that for long-term care financing, and we never really followed through and executed on that. And as I've been here for the last 18 years, we've always known that long-term care, kapuna care, has been a priority, but it never, with everything else that was going on in healthcare, we never could give it the attention it deserved. And I feel bad because I remember as a freshman being presented with a pamphlet from actually Senator Daniel Inouye, who was talking about the silver tsunami is coming. That was in 2006, and we knew it then. But what I would say is that what I take heart from is that as I was listening, especially to the speakers from Washington, who talked about how Washington looked at our 2002 bill. Hawaii may not have been the leader, but we were taking baby steps here and there. So and I think Carolyn is going to go over the kind of the history of where we've been, where we're at. But having been here for the last 18 years, seeing what we did with kapuna care, strengthening that up, seeing what we did with kapuna caregiver program, that was new at the time in the nation. And as I go to the mainland, I go to all of these talk stories or programs and professional developments, you hear people talking more about family caregivers. I draw that directly from the work that we were doing here with kapuna caregivers before the continent was talking about it. So I don't want to pat ourselves on the back because we have so much more to do, but the folks in this room, I look at Judy, I look at the AARP folks, I look at Barbara, you guys are pushing us all the time. And so we have the building blocks here. We really do. And I look at the 10 bills that we have moving. I think those bills are going to continue to develop and evolve over the next 2 months of session. But I think one of the things that we're going to be committed to doing as we come out of this is that we're already seeing a lot of activity with our human services bills moving for funding for community foster homes. So we're going to have more of those building blocks, and I'm just so excited. I got to tell you, I think at the end of 18 years, I'm like, okay, what's my horizon? Maybe another 2 more terms. But let me tell you, this work that you folks are doing makes me want to stay for a much longer time. Thank you very much.
Thank you for those kind words. It was inspiring. Let me validate that. For every issue, you have to have a face. You have to have a story. And I know all of us have stories about caring for our kupunas. But let me bring up someone who also is not just an advocate, but also a policymaker. She is are you president of the center? A director for Center for Innovation, Director of Strategic Innovation, and is part of the Kukua Kalihi Valley Comprehensive Services. Ladies and gentlemen, please welcome Dr. Poki'i Balas.
Thank you, Bennett. So, I don't know, am I tall enough to make the cut? Right. But I think if many of you have been to things I've spoken at, I like to move around and I like to make it engaging. I'm actually on my tippy toes. so that I can see all of you back there. But I want to say aloha kako. And thank you for all of you for being here with us today. Do you see me going up and down? It'll show that the camera too. And to all of our legislators who aren't able to join us, I do hope that you do watch this in its entirety for all of us. So I want to first say, and excuse me for the pleasantries that have to come first, but mahalo to Kia'ili for bringing us with the blessings today. Mahalo to Senator Moriwaki for convening this task force along with Representative Corey Chun. Thank you to Bennett Ms. Fusha for always keeping us on task and leading such great work. Caroline and all of my fellow committee members who are on this side of the room and scattered around as we worked together to elevate systems. It is a privilege to serve on this committee, and it is also a privilege to serve this community. I want to also acknowledge the stakeholders that are in this room and the stakeholders that took the time to come out yesterday. Thank you for the wonderful contributions to the long-term care services in Hawaii. Our legislators, and I think they all left already, the ones that are here now. Hi, Rep, I see you. And many of you who are in this room. I just want to say thank you to those of you who came in person and really made the time to make this a priority, to show the people of Hawaii, to show us that are convening, that this really is a priority in our state. And thanks to your support for considering, get ready for bill numbers. All the bills that we have put forth you that yesterday was shared that is making way from House Bill 2224, House Bill 2216, 1974, House Bill 1827, House Bill 2215, House Bill 1769, and the Senate Bills 849, 3383, and 2285. And it's important for us in Hawaiian culture to say names and to not just group things all the time to activities. So I know it was a little bit, but I wanted to acknowledge all of the bills. And these bills are really innovative to support our system. So right now, we are at a pivotal point and an inflection point to be leaders in the transformative aging services and join our nation in this progressive movement, which I want to be clear is not just local and only to our state. It is also across the nation. It is also internationally. I serve on an international consortium that is looking at this very subject that we're talking about today across multiple countries, trying to come together to figure out how to move forward in this. The World Health Organization has named this the Decade of Aging, and the United Nations has given special attention to things in aging services. So, as I think our PowerPoint isn't working, so I guess I just have to keep going. But what else today from not being able to see us? Oh, it is. And so, thanks, Charles. I'm not sure, can anybody see that? Well, I hope you can. So it is, before I get to the pictures behind me, it is my pleasure to begin today with, as they said, putting a face to long-term care. So let me pose right now. Everyone take a picture. I am the face. No, I'm joking. Okay, and also I think the senator said I have 3 minutes. I'm Portuguese, so everybody bear with me. It's probably gonna go a little longer. So while I am not the face of long-term care or the face of aging services, I am one of over 60,000 faces here in the great state of Hawaii that is accessing these services as a care partner, as a caregiver. And I am one of those who are facing the challenges in accessing the services. And you would think that those of us who work in this system, those of us who are navigating this system and trying to help others to navigate the system would be able to be experts at a system. But alas, it is challenging even for me. And so today I am here to talk to you, legislators, and of course, all of my wonderful friends and familiar faces I see as your constituent. Also as a clinician, a doctor at Kukua Kalihi Valley leading memory care, the director of strategic initiatives at the Center for Innovation, working with a national consortium to deinstitutionalize long-term care and move it into innovative practices. I also am here before you as a former long-term care operator and adult daycare operator when I was interim executive director of Nunalino Home, a Native Hawaiian trust established by our king to put forth the well-being of our kupuna. I have been a public policy advocate here in the state for many years, and that's how I've gotten to work with so many of you in the community. I have been an educator out in the community, in our universities, but a most important role, and the pictures that you see behind me, is that I am a daughter, a caregiver to my father, John Matthew Keli'i Henalu Okalani Balash. He is in the end stages of Alzheimer's disease. I have been taking care of him for over 14 years, helping him to age in place. And not only does that stop with him, but also with my nephew, who's autistic, who is with me also, as I get to navigate through the IDD services. And then as Kiai asked us all to think about the people we bring with us, well, I brought one of my favorite aging peoples with me. My mom is in the audience. So that, so as I speak before you today, it's not just with one lens that I speak to you. It's not just looking at through one perspective. It's looking at all of my lived experiences through my professional and personal life, and the privilege that I get to play a role in taking care of not just my ohana, but the ohana of the state of Hawaii. And I have been through the physical, the emotional, and the financial stresses that most of us face. I just started a minute, a little bit longer. Okay, and so as I speak to you from all of that coming together, many of us work in this and go home and get a break. I work in this arena and then I go home and I do it all over again with my father. It is not ending. It is 24/7. Even when I am not at home, my phone is ringing. Care coordination is happening in a system that has taken me over 2 years to get my father his VA benefits, VHA and VBA, over 2 years for his provider to give the diagnosis, and many, many, many phone calls and stressful nights at trying to figure out how to put this all together. Now, many of you have seen the data sheet, so I'm just going to not go over all the numbers, but currently here in Hawaii, we have over 290,000 over the age of 65. We are expecting that number to double in 15 years, with 70% needing long-term care, and with 11,000 currently DCW, direct care workforce workers in the state. In just 6 years, we will have over 20,000 openings. That is a huge gap to close. And before I close up, I do want us, or just indulge me for this. Everybody close your eyes just for a minute. Okay, no peeking. All right, and just listen to my words and imagine. Light has just hit. A wife wakes up. She's rubbing her aching knees. She's been up all night with her husband. She is tired, but she hears him stir. She slowly walks over to him and sees that he's uncomfortable and tries to soothe him. She tries to move him, but makes little impact. Her hands are sore. Again, she's been up all night. She looks down, it's time to change him, and she knows this won't be easy. So she goes to the kitchen to make some food. She receives meal services. 1 meal a day, and she makes it last all day. She can't get any more connection to services. She doesn't understand why she doesn't qualify, and most of the time the phone just rings, no one calls her back. When they do call her back, she's with her husband, and the process starts all over again. She starts to gather the supplies. She has no checks and no way to get any more, so she grabs a towel. What else is she supposed to do? She looks at the calendar. No one is coming. At $30 to $45 a day and 4-hour limits, she can't afford to get home respite care. Her children, who are caregivers like me, are at work because caregivers are facing financial health crisis. Caregivers are leaving the workforce. Caregivers who are trying to work and take care of their loved ones can't do it. For you, 20% is running through their savings. 4 out of 10 are deciding whether to pay bills or to eat. 3 out of 10 are saying they have no money for food. Her children have to go to work. She realizes there's no one there to come to help her today. She sits down, she hears her husband moaning. She sits in her chair and a tear runs down her face. What is she supposed to do? And everyone can open their eyes. That is the reasons why we're here. Imagine you're in a long-term care facility. There are recordings of kupuna from across the nation saying that they understand that they are not going to get fed or changed because they understand that there's not enough people working in the facilities to do it, that they will remain in bed unchanged for hours at a time. How is this the reality in this nation? How is this the reality in Hawaii? And how is it that we allow them to only have $50 a month when they're in a Medicaid facility? And I am relating this to Senate Bill 849, House Bill 2216, House Bill 1974, $50 a month, and we're only asking for that to increase to 75. Can you imagine that that's all that you'll receive every month in your name? That is all you will have. So what do we do? How do we change this? How do we make this the reality that I won't face in 20 years when I access the system, or my nieces and nephews? Most people don't even know the resources. Look at all of us here. We are all part of organizations that do this, and yet people do not know how to access the services. People do not know where to go. And even when I am in clinic and giving them the resources, they cannot connect. So what is happening in our state? How do we fix this? How is the stories I just told you not going to be the reality anymore of the people that we are serving, of our parents, our grandparents, and the people that we are supposed to be taking care of? So what can we do? We have the NASEM report, we have the RAISE, and we can also look at what other states are doing. Ohio has changed the entire Medicaid repayment system with bipartisan support. With less than $100 a day, their communities are now in surplus and doing innovative models to decrease the DCW shortage. In Maryland, they are looking to decrease nursing home acquisitions, and I'm talking about policy, and reduce multi-beds in facilities. Connecticut is passing a ban on nursing homes that have 4 or 5 or multiple beds. The Greenhouse Project, evidence-based, proven to improve the quality of care, recruitment, retainment, and the autonomy for elders, as we discussed, person-centered care, while many are already moving on to person-directed care and citizenship. Currently, 9 states are allowing caregivers some type of related expense as tax credits. Washington, as we heard, has made their own national long-term care insurance plan. And 21 states have initiated funded programs, and California state has expanded their covered services. I don't want to make it sound like Hawaii is only about challenges. We are known, as was mentioned earlier, for our Kupuna Caregiver Program. We have the BOLD grant, and we are making the Native Hawaiian roadmap for CDC. We are making some inroads and strides. And when I go to national consortiums and international ones, they do mention Hawaii and look to us too as innovators. So this is important to me. I know I got like 1 minute. So this is important to me because of the face up here. I do it because if I don't do something to change it, what am I going to say in 20 years when nothing has changed? And what are we going to say? We talk about the keiki, they're the future, but our kupuna, that is who we're caring for. And that was the future, that still is the future, and that still is the present. And that is honoring them to set up a system for those coming behind us that will change what is happening now. So how do we honor Hawaii? How do we honor our kupuna? A word used so loosely nowadays. What is kupuna? Why are they so important? And this just isn't a kupuna issue. This is a we issue. We have, if we talk about dementia, people in their 30s with early stage. So this isn't an older person's issue. This is a we issue for all of us at any age. We are accumulation of those who came before us, not only by blood, but those who sat in your seats before you. And by doing this, this will honor them. This issue is for all of us to get involved with, for those to honor those who came before us. And as I close out, I just want to say that this is a kako thing. This is a call to action. So at this time, we ask you not to just listen to us, but to do something to create this system that honors the legacy of our future, our kupuna, and our Hawaii. Thank you.
Thank you, Pukili. As you can see, Pukili is so full of passion, born out of experience. And I do want to acknowledge some representatives in the audience. Representative Berth Kobayashi is in the house. Representative Nadine Nakamura. Representative Darius Kila. And I see, Representative Al right there as well. Okay, so, IU, yes. Did I say ow? Sorry, IU. Oh, and I see more people there. Okay. I cannot see. Representative Rachel Lomasao, Representative Deb Morikawa, and we acknowledged Lisa Martin earlier. Okay, it's hard to see with the lights. So let's start with the basics. So here to tell us more about where we are as far as Hawaii is concerned on long-term care is the Director of the Office of Aging under the Department of Health, who has been in her role since 2019. Ladies and gentlemen, Caroline Taribao.
Thank you so much, Bennett. Can you all see me? Can I use the podium? Oh, great. I'm tall enough. Thank you. Well, I'm just going to go ahead and get us started. Oh, thank you. Thanks, Charles. I want to give you some statistics so that you can see what the needs are out in our community. This is Hawaii's growing aging population, those over the age of 65, from 1990 to 2040's projections. Between 2000 and 2040's projections, our population is going to grow at a rate of 137%. That's very telling, and that's why we're here today to share with you some of the statistics and programs that are available, but also what do we need to do to make this system work fluidly. Next slide, please. Sorry, Charles. So 1 in 5 residents are over the age of 65. Our population right now is just below 1.5 million. Next slide, please. So 19% of our population, 20% are above 65. 5% are between the ages of 60 and 64. And then those with disabilities under the age of 65 is another about 7%. When you add that together, our total target population that may need some type of long-term services and supports during their lifetime increases to 1 in 3 individuals. Next slide, please. So who's going to need these services? You heard Poki'i said 70% will need some type of long-term services and supports in their lifetime. And of those, 20% will need it for more than 5 years. Next slide, please. These are just some health conditions that are factors that lead to the need for long-term services and supports. Chronic conditions also play a role, and those living with disabilities. And what I'd like to do, very briefly, I gave you some data, I gave you some statistics, but I have been the director since 2019. I've actually been at the Executive Office on Aging since 2000. I've been in the aging field since 1990. I've seen a lot of growth, and I heard everyone speak before me, and they did such a wonderful job. There's still so much for us to do. Within the spaces we're working in, we're doing good, but there's so many factors that are playing into that. And we heard that today. Housing, cost of living, workforce. Oh, I can go on and on workforce. And I know Senator will say don't, so I won't. But these are the areas where we need to turn it from a deficit to an opportunity. And that's what we worked on yesterday. And you're going to hear some great examples. So I don't want to stay up here longer because we have some great presenters that are going to share with you some of the opportunities that our state has ahead of us. So with that, I'm going to turn it back over to Bennett, who's going to bring up our next speaker. Thank you.
Thank you so much, Caroline. Appreciate all the work and your leadership. So for almost 3 years, the Council of State Governments has been providing technical assistance to our state on this issue. And in his role as the Senior Policy Analyst for CSG, where he has been for 18 years, we're going to bring him up right now to talk a little bit about what's happening for the rest of the country. Ladies and gentlemen, put your hands together for Sean Sloan. Where's Shirley? I'm going to give you my name. Here you go. Here, Sean. There you go.
Much.
Your suit with a maze, really the perfect outfit. Here we go.
Thank you so much, Bennett. All right, so we're ready to go here. Well, aloha, everyone. My name is Sean Sloan. I send you greetings from the Council of State Governments in Lexington, Kentucky. I am a senior policy analyst at CSG, and over the last 2+ years, I've had the pleasure to oversee our ongoing work on long-term care policy. During that time, I've had the pleasure to work with Senator Moriwaki, Director Katarau, and so many great public servants and staff here in the Aloha State. This is my first time visiting your beautiful state, but yesterday truly felt like a family reunion since we have all been on many Zoom calls together over the last couple of years. And yesterday was an inspiring, long anticipated step towards system change that can put Hawaii on a path to better serve older adults, individuals with disabilities, and family caregivers. As we have learned over the last 2 years, there is no shortage of trailblazers that Hawaii can learn from as it continues its journey. Yesterday, we heard how the state of Washington has worked toward expanding the ability of its citizens to be served in their preferred long-term care setting, delivering person-centered care, making community options as easy to access as institutional settings, providing support to family caregivers, and creating a non-Medicaid option to pay for long-term care that was inspired by some work here in Hawaii a couple of decades ago, as it turns out. We heard about the factors that led Minnesota to achieve its #1 ranking in AARP's LTSS state scorecard. And we heard how California is advancing long-term services and support systems change in the context of its master plan for aging by addressing navigation, access to programs and services, financing, and workforce. Next slide. This is the product of the work that we began 2+ years ago with Senator Moriwaki and Director Katarau. This is our long-term care policy guide, which came out in early 2023, and which includes a voluminous number of examples of what states like California, Minnesota, and Washington, and so many more have been working on. We continue to unearth new initiatives and programs, many of which you can learn about in this presentation, which you can get a copy of. There are embedded hyperlinks throughout this presentation that you can take and learn what you will from them later on. Next slide. Yeah, so that in thinking about the ways that so these slides. The long-term care policy guide is also available on our website, the National Online Resource Center. We go to the next slide. In thinking about the ways that states have sought to address the needs of the long-term care workforce, which is the focus of our project, these are the categories that we identified, and we recognize that many of these strategies can overlap and serve multiple purposes in supporting and developing an adequate workforce and keeping them around for the long haul. So we have increasing compensation, but that's not the only thing. We have employment supports. It's not only important to pay folks more who work in direct care, but also to make sure that they can get to the job and stay on the job. Enhancing training and education, facilitating career advancement, expanding the pipeline. The population of folks who can work in these settings. Data collection, monitoring. We heard from so many people yesterday who said that is key, the data collection, so that we can ensure not only transparency, but that it can inform policy decisions. And supporting family caregivers is another key one. Again, you can look at my longer presentation. As you heard, we were on Zoom yesterday, and the whole presentation is now online on YouTube, and so you can watch the whole day. And it was a wonderful day to be with everybody. And so I won't belabor this too much, but so you can check that out. You can check out again this presentation with all of those embedded links to learn more about all of these programs and bills. A couple of things that I didn't mention. You know, the multi-sector master plans of aging. That's for aging. That was something that we heard about yesterday from California and Minnesota. And I think many states have found that kind of high-level cross-sector planning exercise valuable in building partnerships and coordinating across agencies and stakeholders to help determine what's needed to meet the needs of older adults, people with disabilities, and family caregivers in the years ahead. The states that have worked on these master plans have all taken some different approaches and prioritized some different things. Some of those master plans have included components focused on the long-term care workforce. And that's one reason why when we resume our monthly meetings of the National Long-Term Care Workforce Policy Network in March, we are going to hear about some of those master plans. I know some of you have perhaps been able to join us for those meetings last year, which are now all archived on our resource center. But we are going to hear about some of those master plans. I've invited Carrie Graham from the Center for Healthcare Strategies to join us. She has overseen the learning collaboratives that states have participated in. We're also going to hear from a couple of folks who have engaged in these processes in states like Pennsylvania and Utah. The date for that is March 18th at 3 p.m. Eastern Daylight Time. If you'd like to join us, you can shoot me an email and I'll add you to our mailing list. And we'll have future meetings as well coming up in the spring. So I'll always conclude my presentations talking about my parents who are no longer with us. Before they passed away last summer, my sister and I were able to reunite them in a nursing home a short distance from my house, where they shared a room for the last few months of their lives. I'm aware of just how lucky we were that we were able to ensure that they had the great care that they received at that facility, and that we could easily visit them regularly. Many families don't necessarily have that option. So today I honor their memory by encouraging you as policymakers to do everything you can to ensure that the people of Hawaii will be able to provide the best options to care for their loved ones in the years ahead. I thank you for your time today, and thanks once again for the great leadership of Senator Moriwaki, Director Katarau, and all the other folks who have participated this week. Thank you so much.
Thank you, Sean. So the issue of funding and its attendant challenges was one that kept coming up yesterday during the day one of the summit. So we have a panel here who will be talking about right care, right time, right place, redesigning the healthcare delivery system. So they're going to introduce themselves as well as how to moderate this discussion. So Judy, you want to start?
I'll actually start by turning it right over to Nisha Hamill here, although I put her bios. It's in your agenda here. But Nisha Hamill is the Vice President for Population Management at the American Healthcare Association. Sorry, I always get that mixed up, but I'm going to turn this over to her. It appears that you will get to stand over here. So here you go. And we've got the slide behind you.
Well, good afternoon, everyone. Aloha. I said this yesterday, and it holds true. I am truly humbled to be here with all of you, and I am going to keep this short and sweet. From the perspective of Hawaii in respect to the larger national landscape, a lot of these statistics and the data that has been reflected over the past 30 to 40 minutes hold true from a national level. One of the things I believe Hawaii has, and I've been here since Wednesday last week, the superpower Hawaii has is collaboration. Right? That is significant, and I'll tell you why. You see this picture? Oh, it's not there. It was there. Is this. The reason for the challenges in healthcare today and LTSS is all around fragmentation. We specialize, but in specializing, we have created silos. And through those silos, we have created a financing system that both incentivizes and reinforces that fragmentation and more care. So we tend to solve for the parts versus the whole. And I think we've had so many incredible speakers that preceded me that have really emphasized the why and the need for a whole person framework. And I will tell you what I've observed in the last week, and a lot of the discussion yesterday was, how do we all work together as parts of the system? Because we all have a sliver or picture of the entire puzzle. And we need to be able to put that puzzle together in order to really make progress and to solve. So I'm not really here to share with you some kind of brilliant ideas. All of this is to say, there are some models that are happening at the national level. When we're solving at the national level, because of the level of complexity and the breadth that you're trying to solve for, it typically is occurring from a provider specific perspective or a specific population. That works when you're thinking about it from the national level. But if we wanted to work at the state level, and we really want to continue with this thread of the whole person perspective, then it is literally a combination of public and private partnerships to enable it to move forward. None of us can do it alone. It's going to take all of us together. I will say there's been a lot of discussion from yesterday and even prior to yesterday around state government legislators. Thank you for all of those in the room and the passion that is palpable. Senator Moriwaki, thank you. Senator Corey Chung, thank you. Representative Corey Chung, thank you. State agencies, you've got Medicaid, you've got SHPTA, you've got the insurance plans, which is fantastic. You've got a whole bunch of providers. The real goal is better care, smarter spending. The reason we're having this discussion is the demographics are not in our favor. The number of people are increasing. We've got limited resources, very powerfully from a workforce perspective. From a financial perspective, there's not a lot of new dollars coming into the entire system. So we have to look at it differently. We have to look at how can we reduce or readjust spending so that it's not just a treatment-focused perspective. Because the conversations and all the examples were, when you're talking about older adults that predominantly have chronic diseases, an acute care-focused solution is not the solution, right? It is truly about prevention. How do we manage effectively chronic diseases, and how do we support caregivers? And so with that, I will turn it over to Judy. Thank you.
Thank you, Nisha. So yesterday was a real opportunity for us to brainstorm and dive in deeper around particular solutions and directions that we want to go. But one of the things that stood out for me in this entire conversation around long-term care is trying to pull back the lens even further to this idea of whole person care, whole family care, and then thinking about that in the context of the community. Because as Nisha mentioned, the individuals who are receiving these home and community-based services or long-term care, they're in a nursing facility, they have health conditions, they have medical conditions, they're taking medications, et cetera. So this, if we're really truly want to transform the system and have it be sustainable, person-centered, and financially sustainable, then we need to think about it from the whole continuum, not just the long-term care portion and not just the healthcare portion. We actually have to put those things together and think about it as an overarching continuum of services that surround the person to be able to provide person-centered care. Our spending in our country for the wealthier nations is the highest in the world for per person for our medical care, but we have some of the worst outcomes. So just simply spending more on health and healthcare is not going to get us to the outcomes that we're seeking. We are going to have to think about how it is that we are spending those dollars, how it is that we are investing those, and taking a whole person approach, trying to defragment this horrible system. That's what that gobbledygook is over there, right? The more complicated, the more conditions you have, the worse it is, and the worse the system is, and the more fragmented it is. That's Medicaid is the primary payer of long-term care in this country. And we've been trying hard to increase reimbursements for nursing facilities. We're successful. There's some bills to increase it for a few of the home community-based services, which we are also hoping are going to be successful. But just increasing reimbursement rates, service by service, it might be necessary in the short term to be able to help us get sustainable caregiving, et cetera, but it's not sustainable over the long run. Simply spending more is not going to help us in the long run to create a sustainable system. So in order for our state budget to be sustainable, for the Medicaid program to be sustainable, for our long-term care, and for our kupuna, we all have to work together, and we have to commit to working together to do things differently, to truly transform. The only way we can do that, one, is through collaboration, but actually also by putting that person in the center as we're thinking about and working on transforming care. So I'm going to turn that over now to Emily.
Thank you, Judy. I'm going to stand over here too, because I'm on the shorter side as well. But I'm Emily with HMSA, and HMSA is very grateful, I think, to have some space in this conversation, because it really is about creating a system. And oftentimes we refer to kind of the healthcare system, but it isn't always working together. So I think that's the goal. And HMSA definitely has a role as a health organization to come to the table and figure out how we can help fund that model through value-based care and other sorts of initiatives and supports. And we've been trying to do that. And I think Judy talked very eloquently about needing to keep the person at the center. So a lot of our work going forward really has to be collaborating with providers in the community and others in the long-term care space and the healthcare system in general to ensure that the models we're looking at are not necessarily building around the institutions in healthcare, but actually around the person and our kupuna and our families. It's imperative, I think, that we also kind of underscore Judy's comments about there's no new money coming into the system, right? Healthcare is already really expensive, and part of HMSA's, goals and beliefs are that healthcare has to be more affordable. And so how do we reallocate the dollars using different kinds of payment models to make sure that the money is going to the right places and to pay for the care that we all really need and that we can age in place? Part of this approach, at least for HMSA, will be ensuring that we collaborate really closely with key stakeholders, including the providers, to make sure that those models are working to really create the system, right, of long-term care in Hawaii. And I think the more that we can do this together, and for HMSA, that means working this across all lines of business. So our employer-based plans with Judy and the state, and also for our kupuna and the Medicare Advantage plans, will help to bring transformation to this approach. So I want to turn it over to Wes, I think, because a payer alone can't do this, right? I think we definitely need the help and expertise of other providers.
Well, thanks, Emily. Hello, everybody. So yeah, it was really productive day. I'm gonna just couple anecdotes for some of the people that hopefully give a little color to what we're talking about. Is as a provider, number one, you got the weight of the world on your shoulders. In some of our rural communities, we are the only providers. We have to survive, otherwise the healthcare delivery system falls apart. Particularly in the rural communities on Kauai, Maui, Hilo. I mean, there's just a few providers, which is a cursing and a blessing. us providers are starting to see, we don't have workforce, we can't pay enough. How are we gonna do this? And so we just work harder, right? And it's just not sustainable the way we're going. So we said, we got to figure out a way to do this. But all us providers know that we can make for a cheaper system and we can actually fund it better. I went on a home health ride along. So I went into a boarding home and I was talking to some of the people, the home health aides and et cetera. And they were telling me, oh, we need to see somebody who had diabetes. And they said, but that's not the problem. The diabetes is not the problem. It was the cake and alcohol that was in the refrigerator that was the problem. They were having it because the social determinants of health were there, because we weren't navigating the people well. And we all knew that. And I got the same thing as I'm a nursing home operator. Well, you know, if somebody's not doing well, we send them to the hospital, the most expensive place to get the care. Well, if we all work together, that will be cheaper care if we get people healthy, or we stop sending them there because it's more convenient and we all worked at our highest level. And so we think now with this great collaboration, I'm telling you, this is awesome that we're all working together with the plans, with Judy, other providers. It's so possible for us to actually cross the chasm to find a sustainable way to do the delivery system, because over the years, the one thing I dislike the most is having to come to the legislator and ask for more money without any solutions, right? So, we are here trying to do our part to find ways that we can do that. From a provider standpoint, we're committed to this. I think it's possible. We have the collaboration. Just one last thing in closing is, I think when I think of Hawaii and I see what's going on in the continent, I don't think there's a better opportunity than in the state of Hawaii, because we have a close-knit community and we don't have too many providers and we don't have too many insurers, that we all can work together. And not only in this space, but on our workforce space with some of our folks here that, we really got an opportunity. We do need to get this started. We do need to master plan this. But I'm just excited, frankly, that we got a bunch of us up here sitting together, which is kind of unheard of before, right? So, but anyway, I'm going to pass that over and have Nisha close for us.
Well, let me just say this. The time is now. You've got all the confluence of factors. You've got the stakeholders around the table. Hawaii is really well positioned. I have the privilege of traveling nationally, and this is the conversation that's happening in all states. I think Wes said it best, in that you have the right stakeholders. You've got a small enough group of people that can truly work together to affect change. You have to take that step forward. And the fact that you were able yesterday and over the course of this week and obviously longer to get such a diverse group of stakeholders together, to have legislators at the table, to have payers at the table, is a tremendous testament. It is not easy to do this. I will tell you that. It is not easy. So kudos. I say please keep this momentum going, and I will be privileged to continue part of this discussion. Thank you.
Thank you, everyone, for your leadership. So the legislative solutions that are currently in play is going to be the next portion of our agenda. And here to present the current bills, the package of bills, are Senator Moriwaki, Representative Chun, and Representative Lisa Martin, who's the chair of the House Committee on Human Services. Go ahead.
Thank you. Before we go into the bills, you see this. Thank you, Judy, for showing us what everybody has to go through in order to get the services to the person. And so I was trying to put that into a visual for us for the future as we work together. Thanks to my staff, Charles, he was able to put it into the form I thought about it. So here we go. So this is the person-centered care. Here are all the services that we provide. And then in this circle are all the regulations, the financing, all of the kinds of sources of funding. But here, to get to our kupuna, we need case managers, navigators to cut through this stuff here for the services and also sharing data on needs and the person. So if you keep this visual in mind from Judy's to this. Much better. I like that one better. So I just want to put that before us because that's what we were talking about yesterday. And we hope to talk about in the future as we come up with the plan. And we hope that you'll have something for the legislature next year and have this time to really do what Wes and Alicia is talking about in terms of this whole system of care. So we do have some bills, and the bills are at least the stepping stone to get there of what our group has been thinking about, what we need to at least move momentum forward. So I'm gonna turn it over. Oh, me first. Yeah. So me first. So there are a number of bills, and in your packet, there's the last page where it says action now. We're hoping the legislators who are still here can look at that as well. I think the House has been much more supportive of a number of the bills that have gone through. So what you see are the bills that have survived either in the House or the Senate, and they're going to be crossing very soon. So the first two I'll take, and then Representative Martin has been the chair, or is the chair of the Human Services Committee in the House, and she has really shepherded a number of these bills. So she's here to join us, as well as my co-convener, Representative Chun. So I'll take the first two. They are House Bill 2224, which requires the EOA to create that comprehensive long-term care plan. And we hope that this really does pass because this gives us the momentum to bring all the parties in. I think we had most everyone except the hospital, so we're going to work on them in the coming year. But I think that we have almost everyone who provides the services, as you saw on the outside, that we can have a real continuum of care for Kupuna. And as the LG said, if we don't do it, if not now, not us, then when and when, right? So we hope that we can work on that. And the other bill is SB 2285, which amends the functions and the duties of the State Health Planning Development Agency. I call it Jack's bill, Dr. Lewin. He has changed the view of SHPDA, which was really just certificate of need stuff. And that was very limiting. So he's looking at how do we get the data? How do we get all of that information together so that we really do have a comprehensive set of not only data, but providers and everybody on the same song sheet in terms of moving our state forward in a comprehensive way for all healthcare, not just long-term care, but he has included long-term care. So it is part of this whole effort. So I'm really pleased that these two bills, if we pass, we are on our way on a system change. So I'll turn it over to Court.
Thank you. So I'm going to talk about the next two bills. And really what these two bills focus on is increasing our workforce, because we all know with the shortages of healthcare workers, especially in long-term care, this is a major need and something we've been discussing for a long time. So the first bill, SB 3383, is asking the Executive Office on Aging to take a comprehensive look at our workforce. And it's something that we've already been doing and really falls in line with a lot of the things we've already been working on. The next bill is House Bill 1827. Bill is actually part of the House Majority package. And thanks to a lot of the folks in the room, especially Healthcare Association of Hawaii, for actually taking the time to sit down with members and explaining why this is such an important initiative. But basically what this bill will do is to create, first of all, working with the high schools, which is really where we need to start to get our talent homegrown, is to create a system where there's more opportunities for students to get into the healthcare field. And part of that funding will also go to the Department of Education to actually build out health learning classrooms, which is vital if we're going to be able to do this. And then the last part is actually a glide path. So once you get out into the field, it actually provides an opportunity for these students who are now working to actually continue their education so that they have more opportunities and actually can advance and become better at serving the needs that we all have. So, hoping these bills continue to move on. I want to, thank all my colleagues in the House and especially on the Senate side, and especially to Chair Martin for moving these bills because they're so vital to completing the work that we need to get done. Thank you.
Aloha kako. So I'm a brand new chair of Human Services, and I have to say that my agenda on my first day of hearings was all the kapuna bills. And I especially needed to focus on the community care bills because there are so many advocates in the House, and I see Representative Martinez is still here. And basically the every Filipino legislator is really pushing for these bills, and rightfully so. We have bills that are basically trying to increase compensation for community-based care, and that care is largely provided by our Filipino community. And their costs have gone up over the last 16 years, but their compensation has not. So bless them for continuing to provide that care despite the lack of compensation. We did commission a study, the legislature asked for a study to get, an assessment of what our rates were like and what we should do. And those recommendations showed that we were really underpaying and we should dramatically increase the rates. So there's 3 different bills that touch on those types of services. 2 of them, one which was mentioned earlier, to increase the monthly needs allowance from $50 to $75, and another one which allows us to increase by, I think, $132 per month per person, the state supplement to the different community-based care homes that made the list. Those are actually, as a state, we have to do that. We have to spend that money in order to meet our terms of agreement with Social Security Administration. So that is already in the budget, but they just haven't been able to do it because the numbers are in statute. So we have been restricted from meeting our obligations. So I'm hoping that those can pass. There's a lot of support. Many of our legislators introduced bills on those issues. I did try to put the weight of the Human Services Committee behind those and have those be community Department of Human Services package bills. The other one is a rate increase. And again, they gave us options, low, medium, high. It's a tough year between Maui and the hazard pay for our public workers. It's really a tough year. The fact that increasing to the low level, those compensation is in the governor's supplemental budget does not mean that is safe at all, right? No money is safe this year. So anyways, again, we are trying to show support and advocacy for that as a bare minimum. There's other bills that died, for example, that does not address in-home care, which is really important to our kapuna and keeping them at home. And that's something that hasn't made it this far, but we'll try again next year for that. And then the final bill is a Kapuna Caucus bill, and that is a refundable family caregiver tax credit. So that would be $5,000, and refundable is a really important word in there because it means the people that don't owe taxes, so the ones who need this the very most, will also be able to benefit from that. And the benefit is you would need to apply it to maybe modifications in your home or additional assistance for care if you need to hire somebody while you take a break, various things. But it's not enough compensation, of course, for our family caregivers, but it does recognize the benefit that they are providing our entire state by keeping their kupuna at home and providing that free service. So those are the bills, and I'm very hopeful for them this year because of the incredible support from other legislators from the Kapuna Caucus. And I do have to give a shout out to Finance Chair Yamashita because I was waiting to see what would make it through. And almost all of the Kapuna focused bills made it through finance, which really, I do have to give them credit for that. There's a lot of competition with a lot of very, very worthy causes. So thank you.
So although we started late, we're gonna end on time. How's that? Okay, so we have one final activity. And for this one, we have asked the stakeholders to please grab a little flower of aloha because we have a visual manifestation of our commitment. And may I ask, before I do that, I want to just read a little bit and also thank the Department of Education, Wanel Kanashiro. Let's give her a round of applause right there. And Kalani High School for their help in putting this together. I think we're going to have this displayed at Senator Moriwaki's office. So you'll see okay, so it's about the power of collaboration. If you see it, it's a lei, right? Each one of us brings unique skills and experiences, but collaboration is not just about working together. It's about connecting hearts, minds, and resources. It's about building bridges between organizations, disciplines, and communities to create a seamless continuum of care for our elderly loved ones. So today, we commit to listen deeply, speak honestly, and collaborate wholeheartedly to create a brighter, more inclusive future for our elderly community. So let's begin the journey of collaboration and compassion. How do you like that? Okay, so we're gonna start. Senator Moriwaki. Representative Chan. Office of Elderly Affairs. I have a list here. Hang on a second. Hawaii State Department of Education. Hawaii State Department of Health. Go ahead. We have Hawaii State Department of Labor and Industrial Relations. Healthcare Association of Hawaii. Kokuamau. Kupuna Caucus. MedQuest Division. Ohana Pacific Health. Papaola Lokahi. State Health Planning and Development Agency. Dr. Jacqueline. UH Center on Aging. UH John Burns School of Medicine. UH School of Nursing. Workforce Development Council. Hawaii Council Office of Aging. Maui County. United Hospital Care. Elderly Affairs Division. Kokua Kalihi Valley. And everybody else that may not have been mentioned, but please go ahead. HMSA, go ahead. Just put and if we don't have a ready-made one, we are going to create one. Adult Health Center of Hawaii. Okay. All right. Thank you so much for being here. We really appreciate your presence. This is only the beginning, and we hope to see you at future summits. Mahalo. My name is Banette Misalucha. Thank you all for being here. Representative Rose Martinez, go ahead. Put your lei there. Mahalo.